The median nerve lies deep to the flexor retinaculum, approximately 1 centimeter under the skin of the volar wrist. The nerve is located deep to the palmaris longus tendon and ulnar to the flexor carpi radialis tendon. A regional block of the median nerve at this location provides anesthesia to the radial aspects of the palm and the tips of the thumb, index, and middle fingers. To perform the median nerve block, position the patient supine with the arm resting palm up. First, locate the palmaris longus tendon by instructing the patient to oppose his thumb and small finger and flex the wrist against resistance. Needle entry occurs on the radial border of the palmaris longus tendon, just proximal to the proximal wrist crease. Mark the site with a skin marking pen if desired. The palmaris longus tendon may be absent in up to 20% of patients. In this situation, the median nerve is found approximately 1 centimeter ulnar to the flexor carpi radialis tendon. The flexor carpi radialis may be located in a similar fashion to palmaris longus by instructing the patient to flex the wrist against resistance. Prepare the skin with a cleansing agent such as chlorhexidine. Using a 3.5 centimeter 25 gauge needle, place a small wheel of local anesthetic over the needle entry site. Then, insert the needle perpendicularly through the skin and advance it slowly until a slight pop is felt as the needle penetrates the flexor retinaculum. At this point, the patient may experience paresthesia in the distribution of the median nerve, indicating proper needle placement. Aspirate the syringe to exclude intravascular placement, then slowly inject approximately 3 milliliters of anesthetic. If paresthesia is not elicited, carefully redirect the needle in an ulnar fashion under the palmaris longus tendon and proceed as previously described. If paresthesia is still not elicited, slowly inject 3 to 5 milliliters of anesthetic in the proximity of the nerve at a depth of 1 centimeter under the tendon. A major cause of failure of this block is instilling the anesthetic too deeply. The nerve is surprisingly close to the skin, so it is better to err slightly on the deep side of the retinaculum and continue depositing anesthetic as the needle is withdrawn, because the retinaculum is an effective barrier to a successful nerve block from a superficially injected anesthetic. The ulnar nerve lies along the ulnar aspect of the wrist, medial to the ulnar artery. Both the artery and the nerve are deep and lateral to the flexor carpi ulnaris tendon. Cutaneous branches of the ulnar nerve wrap around the lateral border of the wrist to the dorsum of the hand. A regional nerve block at this location provides anesthesia to the dorsal and palmar aspects of the ulnar side of the hand. To perform the ulnar nerve block, position the patient supine with the arm resting palm up. First, locate the flexor carpi ulnaris tendon by palpating just proximal to the pisiform bone as the patient flexes his wrist against resistance. Needle entry occurs along the ulnar border of the wrist at the proximal palmar crease under the flexor carpi ulnaris tendon. Mark the site with a skin marking pen if desired. Prepare the skin with a cleansing agent such as chlorhexidine. Using a 3.5 centimeter 25 gauge needle, place a small wheel of local anesthetic over the needle entry site. Then insert the needle in a horizontal fashion under the flexor carpi ulnaris tendon for a distance of 1 to 1.5 centimeters. Aspirate to exclude intravascular placement, then slowly inject 3 to 5 milliliters of anesthetic. Next, you will need to anesthetize the dorsal branches of the ulnar nerve. Insert the needle at the previous entry site and inject an additional 5 to 6 milliliters of anesthetic from the lateral border of the flexor carpi ulnaris tendon to the dorsal midline. At the level of the wrist, the radial nerve is located along the lateral border of the radial artery. Cutaneous branches of the nerve wrap around to the dorsum of the hand. A regional nerve block at this location provides anesthesia to the dorsal radial aspect of the hand from the thumb to the fourth finger. Note that the tips of the fingers are innervated by the median rather than the radial nerve. To perform the radial nerve block, position the patient supine with the arm resting palm up. First, palpate the radial artery at the radial styloid. Needle entry occurs immediately lateral to the palpable artery at the level of the proximal palmar crease. Mark the site with the skin marking pen if desired. Prepare the skin with a cleansing agent such as chlorhexidine. Using a 3.5 centimeter 25 gauge needle, place a small wheel of local anesthetic over the needle entry site. Insert the needle perpendicularly into the skin, aspirate to exclude intravascular placement, and slowly inject 2 to 5 milliliters of anesthetic at the depth of the artery. Next, you will need to anesthetize the dorsal branches of the radial nerve. Withdraw and reposition the needle, then inject an additional 5 to 6 milliliters of anesthetic from the initial insertion site to the dorsal midline of the wrist.